So I'm very happy to be back again, and today invited by Dr. Sadeep to speak on the research possibility in the Kathmandu University School of Medical Science. And our talk we divided into two, like Dr. Archana along with me. She will be talking on the research possibility in our institute, and I'll briefly highlight what about our institute first. Here the topics Dulikhel Hospital and Kathmandu University School of Medical Science, just to introduce our institute first. Nepal, Craig, you have already visited, and some of folks you have visited. So whoever has visited, that's good, and otherwise you are most welcome. And our populations is multi-ethnicity, and geographical locations is also different from the plain Tarai to high hills. And recently, the Nepal has completely changed politically, and so our the different zones has been changed into 7 provinces now, and so states. So 7 states, and there is a lot of challenges about this new system. And this is also beautiful. Craig, have you visited here? I don't know. It's Pokhara.
I'm from there.
Oh, you are from there. Okay, good. So you must be a little bit nostalgic now. And just to present about the hospital. Hospital has been established to address basically the healthcare system. Healthcare system in Nepal, it's about 30 years ago, let's say. Till that, situation is not much different. Government services are there, which is low cost, but the sufficient services are not available. And in the meantime, private services, which is probably sufficient services, a little better than the government, but high cost. So just to address efficient services with the affordable cost is challenge. So, and to address that, the Dulikhel Hospital has been established. And some of the data shows that financial accessibility in a public, that is very good, but in a private it's quite less. But the adequacy of resources and services are just opposite. So it's a paradox. And so to address that, in 1994 our hospital has been established, and it started to function in 96. And so this is the very old picture, and this picture was just a sketch how the hospital should be built. And that area now no more the barren land, everywhere houses. And I couldn't put the new picture, you have to visit yourself. And this is the area which is from the community given to us to build the hospital. And it was like that when I joined here. Sadeep was trying to address this. So I joined here during this phase when there was no the roof even. So we started slowly, and late King Birendra who inaugurated, and it was a single floor hospital, and with this small ambulance, and we were 2. Then after we became 5, and all are engaged in the care, patient care. And slowly we adding up our services from the outpatients to the emergency to the laboratory and the operation theater and so on. And it is slowly expanding. And now, a couple of years ago, we started even the cardiac surgery, and now neurosurgery is also there. So this is the center of excellence of some of the services in our hospital, where most of the patients are referred from the other parts of the country. So patient trend is drastically increasing. From 2009 I was here, but you can see from 2009 to 16, this all time it's increasing. And now even after 17, 18, 19, it was more or less doubled. In the meantime, we have to approach to the community as well. These are the geography of our country. And so from 1998, we used to go to the community where the patients cannot come to us, we are reaching there. And we started the surgery there as well. And we started building the healthcare center. Reaching there, wherever it is difficult, but still we have a means. So community health program has been started. There the 24-hour services, the awareness program, school health, microfinance, infrastructure development, agriculture, forestry, all sort of things are we are, doing over there. And now Archana will highlight a little bit more about the implementation science as well. We are trying to embed implementation science into those community services with the research methodology. So there we provided the different kind of services, very advanced services, even specialized camps and surgeries, water, drinking water, and the improved cooking system to address the COPD, and school health and immunizations and others. So now I'm coming to the academic part. After this healthcare and the community services, we started in '98 the nursing school, and that's a certificate level only, 3 years course, and it's going on very nicely. This is the only college where the minimum fee possible is with the minimum fee we are running the program, even compared to government. And so Kathmandu University School of Medical Science with the Dulikhel Hospital and University together in collaborations, we are running different programs in 12 medical colleges. And all medical colleges from 94, from 1 to now we have the 12 medical colleges in the country. And this we provide from certificate level nursing to the postgraduate. And this red highlights are the recent development. This year, this is a very, one of the very successful year as BMIT is a Bachelor in Medical Imaging Technology and BSc in Laboratory Medicine and MSc in Public Health. So we started this year. And Archana is one of the faculty. Thank you so much. MSc is first time in Nepal. And our course is 2 years. 2 years plus 6 months internship. So this is one of the picture from there, and most of the program are the problem-based learning and community-based teaching learning activities and evidence-based medicine. And evidence-based definitely also includes the research component. So we are there, and from the western part to eastern part of Nepal, and covering a maximum of number of the populations. And so some of the highlights of our medical program are, there are 12 medical colleges, more than 5,000 bed capacities of hospitals under our university, and specialties service out of the capital city, Kathmandu, because most of the services are in Kathmandu. Because of these medical colleges, we could go beyond there. And specialities are there, and so 10,000 job opportunities and some 1,200 qualified faculties and many more medical services. Nearly half of the population covered from our university medical system. Medical program, we admit the 790 medical students every year. Similarly, BSc 180, BDS 200, and so on. So I haven't put the MSc PS right over here. That's MD, MS, MCS, DM, including the MSc PS as well. How many you said? 10? 10. So 10 in epidemiology and global health, 2 sections. And nice part is more than 60% of our students are female. Probably it's because of the nursing as well, but in the meantime, in the medical and dental as well, female, the participation is high. And in the public health as well, I don't know. And our college is located in the hilltop, and it's just above the cloud sometime. So healthcare, community, academy, and now the one major component is research. Research, when I came here 10 years ago, Dr. Biraj also sends the regard. He was also texting Dr. Sadeep that we didn't understand that much of research. And today, after 10 years, our research faculties are developed, and so some of the potential researches are going on. and so Archana will be highlighting on that. So I just briefly mentioned epidemiology, clinical, some trials is also being introduced, and translational. And how do we collaborate? Collaboration in the PhD and research collaboration, faculty and student exchange, and our index journal. This is regularly published from last 12 years or 13 years. So international collaborations, there are many more, but I try to condense some of the USA collaborations. Among them, the University of Alabama here, we did last time as well, and now we have renewed it again, and hopefully it will be more active now again. Area of collaborations I have already mentioned. So with these 4 foundations, healthcare, community development, academic and research, all these educations, evidences, services, infrastructure is going to be built. And Dulikhel Hospital is, Cafeteria University is trying to give the roof for that, and which will definitely support to develop the community in Nepal. So this is also the milestones, but not in scale. So lastly, few slides about the earthquake in 2015. It was a very dreadful situation there, and many more patients were brought, and we served very actively without any money, without any support, but fortunately we could save almost all lives who came to our hospital, and even the amputations were so less, so that we could provide the services like a complicated fracture we could take care, and with the rehabilitations and with the social support even. So problem is there in our country, that's challenge, and that's the opportunity too. So that's brief of my presentations. This balloon is getting bigger. It's not balloon, it's a size. So way ahead still we have a few challenges. Reaching more unreached, strengthening health system, multiplying capacity by academics, exhibiting model, collaborating international universities, generating evidences, addressing global health issue, establishing the global health. This is now going to be established. Thank you.
I will be focusing on the programs that we do under Department of Community Programs. So as Dr. Koju has already introduced the Dulikhel Hospital, in my view, it has one of the most peculiar characteristics that it stands out in the crowd of other hospitals in Nepal and in most part of the world, that we have a very active program where we connect directly with community. So as Dr. Koju said, so our geography is very challenging. We have mountains, hills, a lot of rivers, so it is pretty challenging for a person at home to come and link with the health facility, and it was true more so even like 10-15 years ago, where the accessibility was very, very limited. So even government of Nepal has this specific program that they have established rural level health centers in all of the covering most of the villages. Even from the most rural community health centers, the time to reach for a person who lives remotest to that health center might be 3 days walk. Because of the geography and lack of road infrastructure. So in our context, it is very, very necessary to go to the community rather than to wait in the hospital and for them to come when they have a problem. And they would only come when there is emergency or like when they have some other fare to come to that area. So we established this network of rural health centers with a vision to develop it as a center of excellence for innovative and holistic approach to community-based healthcare and community development in developing countries. It would not be limited to Nepal. And this platform would also be used as a world-class center for study and research on community health care and development. At a glance, it has currently we have about 20 centers which serves annually about 70,000 patients and has 126. And it is not limited to services. We have a lot of programs, including health promotion and disease prevention, community development. We link academic programs with these centers. We have a very active global health program, health infrastructure. Research is a big component, which overlaps with all of these programs. And we also have started local initiatives. So I'll talk about it later in detail. So in the map of Nepal, this is where our centers are located, the centers are located in the remotest part of each areas. So we have different divisions within the department. So I'll talk about each of these. So in the health services, these outreach clinics, I think we have a picture, yeah. So these are the outreach clinics. It's a mini hospital. It has like medical officers, nurses. It provides preventive services like family planning, vaccinations, growth monitoring of children, delivery. It also provides services like it has a mini surgery. It also provides services like minor surgeries, and a big part of a big program that it facilitates is it hosts camps. So in the regular program where we receive the patients who cannot be treated within the centers, we organize specialized camp for them, and then they visit during the camp. And so this converts into a big hospital, like every once or twice a year, where people from different parts of that area come for specialized services. The patient strength has been increasing over the past 7 years. So this is one of the pictures where we provided services during the flood. It's a very recent flooding in Nepal. Our program was the first to reach there and respond to the emergency, providing immediate health services as well as immediate relief services. We have different health prevention and promotion programs, including targeting women's health, child health, school health, environment health, and non-communicable diseases. So we have a team that works constantly with these health centers, and then they organize health education courses. They reach out to the schools, provide screening of ear, eyes, rheumatic heart diseases. It depends on the priority of the community. Mostly the trained nurses visit every week there, and then there are different groups of people, like women's group or forest groups, like health facility committee, that we constantly interact with and learn from them. And a major part of this program is to provide the health education. We've also recently started community-based hypertension diabetes screening program, and link them with the higher level of health facility. We're starting a community-based cervical cancer screening program, and we have also an active chronic obstructive pulmonary disease prevention program. We're not just limited to health services, health prevention and promotion. A large part of the program is also community development. That includes like improved cooking stock. Dr. Koju also talked a little bit about it. We also had a huge responsibility after the 2015 earthquake, where it was our catchment area was one of the most affected part. So in addition to providing healthcare services, rehabilitation services, we stepped forward and started reconstruction. So we have so far reconstructed about 115 houses that were destructed in that area. We also have a very unique microfinance program where women from the community, they make a group, they make a women's group, and they collect small amount of money. It's not a lot, but that money is enough for them to make small investments, and most of them also invest on goat. So in the community, it's also known as goat programs. But it's been pretty helpful to I would say build the confidence within the women to invest themselves, like invest in the area that they want to invest, make more money out of it, and reinvest. So it's a cycle process. And then we have also a unique program which we termed as Survival to Revival, because it was started just after the earthquake. I'll talk about it with pictures. So this is one of these are some of the women that were enrolled in our microfinance program. It's a improved cooking stove. You can see there is no road, there nothing, so everything has to be carried by people. And the Survival to Revival project. It's also one of the most unique projects in our context. So this is going beyond health development. It's more related to organic farming. So in this area, this specific village always have had a lack of water. So so we did a water harvesting project, and that project supplemented to facilitate in doing the organic farming. So even in our experience, like whenever we used to go to that area, we always used to load our truck with vegetables and like fresh vegetables, whatever we would need for our dinner, lunches, breakfast, and then go there. But now when we go there, then while we come back, we load our trucks with vegetables, but we still need to link these products with now we are working with students and faculty from Kathmandu University School of Business to connect these products to the larger market. So it's one of the most, like, I think, the successful projects of the Department of Community Programs. So we are starting a new academic program, Master of Science in Public Health, and we have two tracks, epidemiology and global health. So in Nepal, there are like only 5 other universities that provide Masters of Public Health course, and all of them are focused on general, like in Nepal we call it general public health, like, which is like more health promotion and prevention, health education, and like maybe descriptive research sort of things. But in the recent years, what we have really strongly felt is lack of human resources on global level networking and collaboration, and then just to go beyond Nepal and make an impact on larger global population and research. That's the one we've always struggled with, because research has been developing even within the universities in Nepal, like only recently, like last 10 so I heard the story of Sadip Dai that when he visited KU like 10 years ago. So he talked a lot about what has to be done in cervical cancer research, and everybody was so amazed of his ideas, but nobody understood it. So whereas my very good friend who leads the Department of Community Programs, he told me, like, I didn't tell you last night, but he told me, like, he came and then he talked, like, he talked such nice things. It was so nice, but we didn't understand anything. And then now we are like, now all of those things are making sense. And in the past 5 years, we've been pretty successful in getting international grants, like doing scientific research in Nepal. So we felt that we need to build that human resource to take these initiatives forward. That is why we started. We plan to start epidemiology as one of the main core tracks. So the global health, we also have an active global health program. So right now it is mostly structured training programs for international students, short-term clerkships, short-term internships, and research-based training. Like most of them come for their master's dissertation or their PhD dissertation, and then we provide platform to them. We have a faculty dedicated who interact with these students and then provide them continuous mentoring when they are there. Last year we have had pretty good number of international students, mostly from Austria, Germany, US, Norway. And then now we will integrate this program within our MPH Global Health, MSCPH Global Health program. It's one of the nice pictures of our with our international collaborators. We also have a health informatics. It's a informatics division. This was recently formed, like 2 years ago, and what we hoping out of it is to convert all of the paper-based data into electronic database and integrate artificial intelligence and a protocol-based electronic medical practice system. So right now we are developing a program for developing the softwares for family health program, women's health, school health profile, livelihood database, stroke registry, and birth record. We have partnered with one of the IT companies in Nepal, and they are, and then we are together developing, testing, continuously like upgrading and improvising this database. So our the main concept is we would link all of the households in the community. We'll have a electronic database. Whenever they come to our rural health center or hospitals, there will be a unique identity, most likely fingerprint, and they can be tracked for the health prevention, promotion, referral, treatment services, and all of these database would be a very good platform to answer the multiple research questions. We are very interested in epidemiology, clinical research, implementation science is also a big part of what we do. So this, and then we also are creating a database for birth cohort. So we will register all of the women who come to the hospital or health centers during their antenatal care, and they will be followed up until their child is 5 years old. So I'll take a little bit longer time for this slide. So these are our major ongoing research we have more than this, but these are like mostly like bigger funded research. So first is our Dhulikhel Heart study. Actually, if you click a Dhulikhel Heart study in the Google Scholar, you will get a multiple number of articles that we were able to publish from this. We started the Dhulikhel Heart study as a cohort study in 2013, where we collected the data from community from at their house. So it includes the data on their demographic, socioeconomic status, cardiovascular risk factors, including smoking, alcohol, diet. We also developed specific food frequency questionnaire and then validated that for that specific population. Physical activity, mental health, that includes stress, depression, anxiety. We have data on cognition, quality of life, physical function. So we collected a lot of data in 2013. We are following them up in 2019. We were actually planning to follow them up in 2015. After 2015 earthquake, we had to divert a lot of resources to other priority areas but now we are gathering things back in place, and then doing our fast follow-up in 2019. Right now the cohort is 1,083 people in our cohort, but now this year it will be extended to about 5,000. It's very similar to the Framingham Heart Study, which was done in the city of Framingham. So this is also, like, Tullikil is also the name of the city, so we will cover all of the adult population of Tullikil. Everyone will be enrolled in 2019. Other studies, Nepal Pioneer Worksite Intervention Study. It was NIH funded. DP award. It's a 2-step pre-post and randomized controlled trial. So we have 3 work sites. It was a pilot study. 3 work sites. One of them is the hospital, Tullikil Hospital. 2 of them is steel manufacturing factory and textile manufacturing factory. And we screened employees of these, about like 1,500 employees were screened in total, and out of them 550 were high risk, meaning they had either pre-diabetes or pre-hypertension, and then they received intervention in 2 levels. First, they received intervention at the cafeteria environmental level, and so we want to see the effect of environmental level change. So we changed a lot of things in our cafeteria, removed all of the unhealthy diet, like high sugar, like there is no high sweetened beverages, sugar sweetened beverages, any like sugar sweetened pastries or foods were removed. We changed white rice to brown rice, and we added fruits and vegetables, and we also did a lot of work with the menu of each items, like adding more lentils, removing animal fats. So we did a lot of those things, and then in the next level we did a randomized trial to see if individual level intervention have how much of additional effect compared to the environmental level intervention. We have another big partnership with NHLBI. This is on capacity building on translational research to prevent and manage cardiovascular disease in Nepal. It's a nationwide program to build capacity and assess the readiness at national level to prevent and manage cardiovascular disease. Out of the 4 years, we are now at the end of second year. We have recruited 16 fellows, professionals from all over the Nepal, who work with us as a fellow, and then we train them on translational research. And then we also do a nationwide need assessment. It's mainly a qualitative kind of study, and we will supplement with a readiness survey of health facilities. And then we have interviewed about 52 national level stakeholders, including health ministers, like health secretary, chief of the health services divisions, and then other stakeholders in the community, like patients, their family members, healthcare providers, universities. We're yet to analyze those data. I'm very excited about it. We also host Lancet, National Commission on Non-Communicable Diseases and Injury. Again, it's a commission of 24 major stakeholders throughout Nepal, and we meet every 3 months to discuss. So we have like 2 components. One is to analyze the secondary data. For basically, we use global GBD data, global burden of disease data, which has been very underutilized in Nepal. 2 papers are coming up. It will come up like in 2 months, and then based on that, we prioritize our health needs. It's presented to the health minister at the health ministry level, and then convert it into actionable recommendations. Also, we have a big infectious disease surveillance and research funded by Gates Foundation. We collaborate with Stanford University on that. We do national level surveillance of enteric fever. Also, we are part of enteric fever vaccine trial in Nepal. It's also funded by Gates Foundation. We work with the World Diabetes Foundation to develop nurse-led continuum of care to manage diabetes in Nepal. So the core concept of that project is to train nurses from identification to the management of complication for the diabetes. So there will be a single point of contact in a clinic or in a hospital setting, who will connect with the community, connect with higher level of facilities, and they just facilitate the continuum of care of diabetes patient throughout throughout their healthcare needs. Basically, like Nepal and other developing countries, health system was developed to address acute diseases rather than chronic diseases. So it's never been tested anywhere else. So we are very, very hopeful that this strategy would be very crucial to provide a complete care to patients. Also have gestational diabetes prevention study in rural Nepal. It is integrated with M-Health, developing mobile-based health care information to all of the women who have gestational diabetes, and then we would see in the long run whether or not that was effective in their management of complication and birth outcomes. We also have community-based diabetes and prevention program. It's a cluster randomized controlled trial where they will be randomized to receive a community-based diabetes hypertension prevention curriculum. The curriculum is based on the diabetes prevention program, which has been proven to be successful in many parts of the world. We also have a community health worker-led diabetes management in Nepal. So we are testing two different strategies. One is the nurses-led, which would morely be centered in the hospital health centers. We also have a community health worker-led diabetes management cluster randomized control trial in the rural. It covers both rural and urban parts of Nepal. We also have started rural women's health cohort study. It has about 2,000 women in the rural areas. It was and then we did CVD screening, cancer screening, and then we are also following in 2013, and then we are also following them up this year. So this is the cervical cancer prevention in low resource setting. It's an implementation trial in Nepal. It's a collaborative project with the Yale Cancer Center, where we were in last week. We were there. We work with Sten, who was here before, and Donna. She was in Harvard before, but now she's moved to Yale. So we are testing a single approach screen and treat with VIA and cryotherapy at the rural health centers. And that includes both government health centers and hospitals health centers. And then just see the implementation process outcomes, like what was the fidelity, what was the coverage rate of coverage, coverage rate, like whether or not it was accepted, adopted by the health workers in the health centers, whether or not it was accepted, adopted by clients, what was the satisfaction level, what was the facilitators of barriers at both levels, and what was the cost, what would be the maintenance cost for the government, what would be the startup cost for the government, because government does have a cervical cancer program and a guideline, but it has not been implemented. So we want to gather the evidence to facilitate, scale up that program. We also have two main studies with rheumatic heart disease, both of them funded by NIH. One is to look at the effectiveness or like reach coverage by screening the contacts of RSD patients. So we are developing a rheumatic heart disease registry, and then we will be screening the contacts of the RSD patients. And then we are also doing a feasibility study, it's R34 feasibility study of statin, and to see statin trial, to see like if statin can be effective to delay the progress of RSD in the patients. We are also developing and testing M-Health for diabetes management. So we are collaborating. It's also an NIH project for collaborating with, I always mess that up, Rutgers University in New York. So we are working with our IT team to develop interactive application for diabetes management in the community, and that would be uploaded in the mobile of the patients and connected with the mobile tablet at the health centers, and then see if it would be helpful for the management of diabetes. So these are the some of the research that we do, and of course it is not limited to these, and also like the program, the other health programs, we also planning to systematically evaluate other like school health programs or community-based public health prevention and promotion programs. So all research would also be integrated within other projects. Okay. So these are some publications. This is a beautiful picture of NCDI Poverty Commission, the Lancet Poverty Commission, and then we published our first report, which has been now adopted by the government of Nepal. This is our team of Nepal Pioneer Works at Intervention Study. He is the star, Mr. Thakur, who is the chief chef of the cafeteria. Everything that was thought to be impossible, he made it possible. So now you are most welcome to have healthy lunch, breakfast in our cafeteria. We have a local initiative. So in Nepal, moved from centralized government to decentralized government recently. So that means that now the health is led, monitored, guided by local governance, which includes like mayor of the municipality. So now we have partnered with the Dhulikhel municipality, where the hospital is located, and part of local initiatives, we work very closely with the local government on water sanitation, waste management in the city, food handling and hygiene. We are monitoring all of the restaurants of the city, and provide them training and continuous monitoring, and ensure that they provide healthy foods, healthy and hygienic foods. Also monitoring road traffic accidents prevention and non-communicable disease care within the government health system. So last two slides. So often when we talk about like research, community development, or like healthcare, we really want this road to be very, very smooth, so that anything can go on this road. And mostly when I am in the US, like I see this kind of road everywhere, like beautiful sceneries, and then nice like black topped road, very, very smooth, where everything can road on their own speed. But in Nepal, like we have this kind of road and you can imagine how much time, energy, patience, inspiration, motivation, like all sorts of those emotions are necessary to keep things moving. And I think that this is challenge, but this is also an opportunity for us, because it makes us more creative, it makes us more innovative, and it just challenges that core part of your brain that you want to like really keep moving on and make difference in people's lives. So with that, I want to thank you. It's one of the pictures from our, we also provide health services to monasteries in Nepal, so children from those monasteries. For more contacts, you can email me or Dr. Koju in this.